Right. Welcome, everyone. We're so excited to have you here for the next installment of our webinar series, Cystic Fibrosis Newborn Screening Parent Experiences. I'm Marissa Taylor from the Center for Public Health Innovation, and I'm really excited to be able to facilitate this meeting, this webinar today. We have some expert presenters today presenting on their experiences: Karey, Cambrey White, and Faith Shropshire, as well as Marissa Taylor from the CF Foundation. And so before they get started, I just wanted to make you aware of a couple of other, there we go. A couple of other resources that are available for CF newborn screening. I'm here at the Center for Public Health Innovation. We have been sponsored by the Cystic Fibrosis Foundation to run CF newborn screening collaboratives. They have just begun, and this is to include state newborn screening public health teams and CF centers who are coming together to tackle problems in CF newborn screening. We also have this monthly webinar series, which this month is actually it's more than actually just once a month, but covering topics across the spectrum of newborn screening. And then I also want to make sure everyone's aware of the special issue in International Journal of Neonatal Screening that is dedicated to cystic fibrosis newborn screening. And that deadline has been extended to June 30th. And so hopefully some of you might be working on some applications or some manuscripts for that journal as well. So again, I'm very excited to be sharing with you our presentations today. We're going to start off with the Cystic Fibrosis Foundation's activities and Marissa Taylor, and then Karey, Cambrey, and Faith have been kind enough to share their experiences going through the newborn screening process. And I just want to highlight before we get to that, these three parents also served and are authors on our newborn screening guidelines that have recently been published. And so hopefully you've all had a chance to see those guidelines, but they were very instrumental in helping us to understand different aspects of CF newborn screening, and we're very grateful for their participation in that process. So with that, I will hand it over to Marissa. Marissa, it's all yours.
Great. Thanks, Marcy, and good to see everybody. I recognize some names on the call, and for those who don't know me, my name is Marissa Taylor. I work at the Cystic Fibrosis Foundation in beautiful Bethesda, Maryland. I've been at the foundation for a while now. Today is actually my 8-year anniversary with the CF Foundation, and I have been managing our newborn screening work over the last several years. So before we dive in, really, I think, to the most important part of this presentation, which is hearing from our three parents, I wanted to provide some information on different activities that the CF Foundation has funded to support states as they seek to implement the recommendations in the guideline that Marcy just mentioned. So that includes the Screening Improvement Program Award for optimizing the diagnosis of infants, which is a mouthful, so we lovingly refer to it as the SIP Award, and that award closes for applications on July 15th. I did want to highlight, because of the topic of this webinar, align within the eligibility criteria of the award, which says efforts should be made to incorporate the people served by newborn screening into the improvement work and to identify best practices. So I hope that we have some of you all applying for the award, and we look forward to reviewing those applications later this year. We are also working to fund the collaboratives that Marcy mentioned, which have a wide variety of topics that are listed here. And then the genetic testing resource centers, which there have been previous webinars about, with services including comprehensive sequencing of the CFTR coding region and flanking intronic regions, and technical assistance for programs that are seeking to implement next generation sequencing for CF. Okay, a couple other things that I wanted to mention were some programs that the CF Foundation supports for people that have been newly diagnosed, including Community Voice. This is the Cystic Fibrosis Foundation's virtual program that connects people with CF and their family members with meaningful opportunities to shape research, care, and CF-related programs. And you can see here a list of some recent and upcoming topics for those involved in Community Voice. All of these projects have clear plans for how community input will be used to make sure their time and experience have a real impact. And Community Voice members can participate as much or as little as they'd like, and some opportunities are compensated. And while most projects for people with CF are for people with CF and parents of children with CF, anyone is welcome to join and receive monthly updates on how the CF community is making a difference in research and care. Another opportunity we have is CF Cure Connect. And this is a program that allows people to connect with people that are like them, whether that is a similar experience or similar background. There's personalized matching around topics and similarities that matter to those people. It's a great way for people that have a newly diagnosed child to connect with others that have gone through similar experiences and to really relate to somebody in that one-on-one way. So I've put little blue hearts next to the parts that might be most important to parents of newly diagnosed children. You see a new diagnosis there under new transitions and next to family life. So since 2004, the CF Foundation has included people with CF and/or caregivers on guideline committees. And Community Voice, which I just mentioned, was officially formed in 2014. And Community Voice is where we send our asks out for parents or people with CF to join our guideline committees. So in addition to the 3 parents that are on this call, Karey, Cambrey, and Faith, who were a part of the guideline committee, the public comment draft was also sent to individuals within Community Voice so that we could hear the perspectives of parents, caregivers, people with CF, et cetera, on the recommendations within the guideline. On this slide here, I've shared 2 quotes from a publication about family involvement in the development of CF Foundation guidelines. I'll read this one on the left hand of the slide, and you can read more in this paper that's linked here on the slide. So there is a feeling of empowerment that comes with being treated as a colleague and not just a patient. The role of guidelines continues to grow as evidence-based medicine becomes the standard. Those guidelines inform the care we receive and are expected to adhere to. Co-production of guidelines is vital to ensure that patient wishes and needs are always at the center of guideline development. So as I mentioned, we had 3 wonderful parents of children with CF on the guideline, all of whom you'll hear from today. Faith, Cambrey, and Karey were instrumental in the development of the guideline from beginning to end. They attended monthly committee meetings. They helped develop our research questions. They helped write our protocols. They were part of the literature review. They helped to write the recommendations. They voted on the recommendations with the rest of the committee, and they assisted with writing. But most importantly, they brought their invaluable expertise to the guideline. They're experts in knowing what it is like to navigate the newborn screening system, both when it goes right and unfortunately when it doesn't work as it should. You'll hear their experiences in this presentation today. And I'm going to pass it first to Megan, who's going to talk through the guideline itself in brief, and then we'll hear from our 3 parents.
Hi, everybody. I'm Megan McGarry, and I just want to really state again that, Karey, Cambrey, and Faith really changed our guidelines, that they were not just here as just to sign off on things, but they really drove a lot of the recommendations and made this so much stronger. And we're so appreciative of them, and we're so excited about this. So if you haven't seen the newborn guidelines, we'll put a link in the chat. But these are really guidelines that came from review of literature that address all the different areas of CF newborn screening, from IRT levels to the genetic panel to genetic sequencing. And then really what's most important is the communication of those results to the providers and to the family. And each step of these is really important to making sure that all babies get a timely diagnosis, and it's done in a way that is best for the families. And so if you haven't read this, we encourage you to read them and to think about how you might take these changes to help improve it in your state. So. This is an overview of the different recommendations. So as you can see, moving from the blood spot collection all the way down to communication results, we have 7 main recommendations and then many other discussion points in the guideline.
Excellent. Thank you so much, Megan. So with that, I'm excited to be able to introduce our first parent who's going to share her story and her perspective of really newborn screening for CF by the books. And this is Karey Padding. Karey, I'll hand
Thanks,
it to you.
Marcy. Good to see Megan and Marissa again and the team. It was a really great experience to be a part of the newborn screening group. I can't believe it's been 3 years since we started until it's finished. It was an amazing experience. But my name is Karey Padding. I live in the Wichita, Kansas area. I grew up in north central Kansas in a really, really small town. And what you see on the screen is my firstborn, Gavin. So when my husband and I first decided we want to have children, we knew we may have some issues because my mom and her sisters had problems getting pregnant. And so my husband and I struggled getting pregnant and also staying pregnant. So unfortunately, we had a few miscarriages. And once we became pregnant with Gavin and everything finally stuck and we knew we were going to have a baby, we were just so excited. I am a social worker. I've been a social worker for 25 years. I have a history in case management and Medicaid and organ transplant. Feel like I'm pretty smart, well-versed, and I like to read and be educated. But one thing I didn't know a lot about was newborn screening. I may have gotten a pamphlet when I went to my OBGYN. I'm sure it was in a bunch of handouts that I received, when you were going to your appointments, but it's not really something I even paid attention to. So when Mr. Gavin was born in November of 2010, I was surprised to see somebody come in and say, we're going to do the newborn screen. And I'm like, well, what is the newborn screen? Please educate me. And so they let me know they're going to prick his heel. I barely remember it, new baby, mom hormones, tired, because my birth plan didn't go the way it was supposed to go. I was supposed to have a natural birth. I ended up having to have a C-section. So those things didn't go as planned. But the newborn screen went pretty much as expected. So Gavin had his newborn screen. He had his hearing checked. He had the blood spot. We went home from the hospital. We didn't know anything what was going on with him. We got a phone call probably about a week after we went home, and they told us that Gavin's blood spot was not done appropriately and that we needed to go to our pediatricians to have it redone. And so we did. We took him back in. We're like, well, what are they looking for? What's going on? They're like, oh, this happens sometimes. Sometimes they don't get the blood spot filled out correctly. But we want to make sure that he doesn't have something going on that is genetic that can be treated. You need to know about. So they're like, okay. So we just really didn't know what was going on. So we got the call, several days later that unfortunately that Gavin was flagged for cystic fibrosis. So my doctor was really great. Kind of talked me through everything and said, we're going to set you up immediately with the closest cystic fibrosis care center here in Wichita at Via Christi. What they're going to do is they're going to give Gavin a sweat test. They explained what that was and said that's going to be the gold standard for a diagnosis. So this screen is just saying, hey, he's got the most common genetic mutations for cystic fibrosis, but you need follow-up. So of course we were shocked. We had no idea we were carriers because I didn't do any testing, neither did my husband. It doesn't run in our family. But really the newborn screen did what it was supposed to do, right? I mean, it caught it. Even though we had to go back and have it redone, it was still very quick. So by age 3 weeks old, we had a diagnosis. We met with our CF clinic care team to get introduced. And by 3 weeks, he was taking enzymes off a spoon with applesauce. We were doing chest CPT, on his 6 zones, and we're doing 2 breathing treatments. So we really were set up for a good trajectory, a good health trajectory for him, because we found out so quickly that he had cystic fibrosis. And because I'm a social worker, that really kind of just ignited my passion for advocacy. So I kind of went on to do some really fun things in the newborn screening realm. I joined our newborn screening advisory council for the state of Kansas. I actually joined a national committee in 2013 for newborn screening. And I was really prepared for the second time around. My husband and I were like, yeah, hey, we've got this. I think we both know we're carriers. I think we both want to have another baby. Let's do this. You can flip to the next screen, Marcy. And unfortunately, we got triplets this time. So when we decided to have our second baby, we got baby number 2, 3, and 4. So we have triplets now. Gavin is now 14. He'll be 15 in November. And we have triplets that will turn 12 in about a month. I was so much more prepared the second time around. Obviously, I knew what newborn screening was. I knew as soon as the nurses were, in the NICU, what they were looking for. I knew during my ultrasounds what they were looking for during those times. So I just felt so much more prepared. Had friends at the state lab. Shout out to Michelle Mills, the newborn screening lab manager at KHEL, who's just been such a fantastic advocate for me as a parent, but also for bringing parents involved into the newborn screening advisory council for the state of Kansas, for parents to be able to share their stories, but so much more prepared the second time around. And that just really led to really igniting my passion and my fueling of love for advocacy. And I've been able to move forward with, I currently chair the Kansas Council on Developmental Disabilities, been part of Wichita Women for Good. My son, Gavin, who has cystic fibrosis, also has a diagnosis of autism and is nonverbal. So, there are certain challenges that Gavin has on the day-to-day, but, as a family, we conquer those together. And there's so many ways to be involved if you know where to look. And I know we're going to talk about that later on. But that's a little bit of our newborn screening story of kind of how things went the way they were supposed to go. And I really wanted to be part of this group because I know my story is not everybody else's story. I have so many other friends that I've met along the CF journey whose newborn screening story did not go this way. And so I'm going to pass the ball over to Cambrey, who's going to tell you her story.
Thanks so much, Karey. And Karey, I really looked up to her. She was one of the first CF moms I met when we first got my son's diagnosis. So good afternoon, everyone. My name is Cambrey White, and I am mom to Roland, who is 4 and living with cystic fibrosis. I am so thankful to share my family's experience with cystic fibrosis newborn screening today to all of you who are in a position to advocate for and improve the newborn screening algorithm in your state, as well as help improve communication between various healthcare professionals to ensure diagnosis occurs in a timely manner. I think that the situation we experienced can be used as a tool to improve the newborn screening process for the future, and I am so thankful that I've been able to play a small role in the recently published newborn screening guidelines. So I first found out that I was pregnant in the fall of 2020 when we were living on the island of Hawaii amidst the height of the COVID-19 pandemic. My husband, Brian, has a cousin living with cystic fibrosis. He was unsure if he was a carrier, but he knew enough about CF to have some concerns. At my first OBGYN appointment, I requested a carrier screening specifically for cystic fibrosis. The OB explained that she would test for me, and if I was negative, there was no need to test my husband since both parents need to be carriers of the CF variant in order for a child to have CF. My test was negative, so that was that. My son Roland was born in June of 2021 in Los Angeles, 2 days after his due date. I had an uncomplicated pregnancy and birth. Our newborn screening results came back by mail about 3 weeks later, and those results were negative as well. At birth, Roland was in the 40th percentile for weight. We started seeing some issues around 2 months, and he had dropped from the 40th percentile to the 15th percentile. That's when I became worried. I reached out to our pediatrician with my concerns, as well as to family and friends, to see if anyone else had experienced a similar situation. Almost everyone I spoke with, including the pediatrician, reassured me that there isn't anything to worry about. Their intentions were well-meaning, meant to calm the anxiety I was experiencing. After all, I was a postpartum mom with my first baby. I was sleep deprived, and I had one job: to make sure my son was alive and growing, but he wasn't growing at the rate he was supposed to. The juxtaposition between people all around me reassuring me that everything will be okay, and that feeling in my stomach where I knew something wasn't right, resulted in a fog where I attempted to convince myself I wasn't crazy, but I certainly felt like it at the time. When Roland's weight dropped from the 15th percentile to the 3rd percentile, my husband and I advocated to have Roland referred to a pediatric gastroenterologist, and our pediatrician agreed. Our pediatric GI provided various interventions to help Roland gain weight. After 4 months of age, my husband Brian and I advocated for blood work, stool samples, and a sweat chloride test, since we knew what one was from Brian's cousin. But since Roland was gaining some weight, although slow, our pediatric GI felt it wasn't necessary at that point in time. However, a couple of months later, when Roland still wasn't gaining weight well, the pediatric GI agreed that these tests should be done to figure out what was going on. I will never forget when we received Roland's CF diagnosis over the phone. To this day, I remember exactly what was said, where I and Brian were sitting in our kitchen, and what it felt like when it was shared that Roland had a sweat chloride test indicative of cystic fibrosis. I will never forget the anger that rushed through my entire body, because I thought we had done everything right. We had requested the carrier screening. We had shared with our pediatrician our concerns about his weight gain, and that there was a family history of cystic fibrosis. A public healthcare program that was intended to support families with challenging diagnoses at birth failed our family, which broke my trust in public health program and doctors. Today, I still do struggle with the trust, as sometimes I do fear, what if the tests are wrong? What if the doctors are missing something? In January of 2022, Roland's CF diagnosis was confirmed after the blood spot that was originally used for his heel prick was sent to Stanford for sequencing, where they found 2 rare cystic fibrosis variants, 2184 insertion A and H609R. Shortly after, I signed up to receive community voice emails from the Cystic Fibrosis Foundation, when one opportunity felt particularly relevant to our situation: applying to be a parent perspective on the newborn screening steering committee. When we received the news about Roland's sweat chloride, I thought I would be alone in my anger and disappointment. But when I joined the committee, it was so bittersweet and meaningful. I learned that there is an entire team of experts wanting to improve newborn screening so other families wouldn't have to experience what we did. I really can't even put into words how meaningful the experience has been, and it has definitely been a way to reconcile what has happened and turn it into something positive. So I feel grateful that Roland's CF diagnosis was caught at 6 months, and I attribute this to a few reasons. Brian and I knew enough about CF to advocate for a sweat test, and we had moved back to Los Angeles from Hawaii, and we had access to a pediatric GI at a hospital with a CF care center. I am almost positive if we had stayed in Hawaii, we would not have a CF diagnosis right now. With that being said, I do feel that there were some missed opportunities where Roland could have been diagnosed even sooner than 6 months, and I would love to address those. So we'll start with the carrier screening. I learned that the carrier screening I took was a 23 CF variant panel. The CF variant I carry, H609R, which is primarily found in Ecuadorian populations, and I am Ecuadorian, was not on the 23 CF variant panel. In retrospect, since we had a family history, we should have been referred to a genetic counselor. Regardless of family history, I do find it interesting that I did a carrier screening in Hawaii, the most diverse state in the country, and I was only tested with a 23 CF variant panel, which largely tests for variants found in populations of European descent. The sensitivity for those of Hispanic populations in the 23 CF variant panel is 72%. And I think that there could be more education surrounding sensitivity of CF variant panels for OBGYNs. I gave birth in California, and I learned after his diagnosis that the first step in California's process is to test the IRT level. My son had a very high IRT at 323, far above the expected value of less than 69. The high IRT triggered the next step in California's newborn screening process, which was to test for the 77 variants on California's CF variant panel. Since 0 CF variants were identified, Roland CF newborn screening was considered negative. Had California had a VHIRT failsafe, Roland CF diagnosis would have been caught on the newborn screening. Had California had a larger CF variant panel that included at least one of Roland's CF variants, Roland CF diagnosis would have also been caught on newborn screening. If you look at recommendation 2 and recommendation 4 of the newborn screening guidelines, had these guidelines existed and were implemented in 2021, both of these recommendations would have resulted in a positive newborn screening for Roland. I'd also like to note that there was a study in 2020 out of Ecuador that showed that H609R is just as common in people of Ecuadorian descent as F508del. So while it's rare in the US, it's not that rare worldwide. Finally, there were multiple factors that were red flags that we had shared with our pediatrician. In addition to sharing our concerns about slow weight gain, our pediatrician had our newborn screen that had showed a high IRT, and we shared about my husband's family history of CF. Another missed opportunity is that the pediatrician could have identified these various pieces of the puzzle and referred Roland for a sweat test much earlier than 6 months. Suggestions for improvement include pediatrician education on symptoms of CF, newborn screening, as well as when to refer an individual to a CF care center and/or sweat test. I have worked really hard to get past the shame I used to experience that had I took a look at the mail and see the newborn screening results and notice the high IRT, that perhaps I could have alerted the pediatrician and gotten a diagnosis sooner. With that being said, this is the cover letter that was mailed along with the newborn screening results, which explicitly shares the testing of your child is negative or normal. No further tests are necessary. When you look at the newborn screening results, they do appear confusing and contradictory. I do understand why the pediatrician wasn't concerned. In the middle of the paper, it shows there was an elevated IRT. It's in the red box in the middle of the paper, but that no mutations were found. However, down below, it explains that this does not exclude the presence of rare mutations. If this baby has symptoms of CF or there's a family history of CF, to call your newborn screening coordinator. Roland had both, but the pediatrician didn't put these together, and I didn't take a good look at the newborn screening results because of the cover letter that was sent. My intention in sharing this isn't to be critical. I recognize that our situation is extremely rare. Rather, I share these missed opportunities for improvement among various processes for the future. When I first joined the Newborn Screening Steering Committee, my emotions were raw and unfiltered, but now, 3.5 years later, I'm much calmer and I feel so grateful for those in the healthcare field, like all of you sitting on this presentation today, who have taken time out of their busy schedule to hear about our experiences. It really does give me so much hope that those who are more likely to have a missed newborn screening, often people of color, are not forgotten, that our experiences matter too. And really, I am just so grateful for the collaborative work that you all do. So this is Roland today. And while we have had 2 hospitalizations, overall, he's doing very well. He's gaining weight well now, and he's now on a modulator. I really can't thank the CF community enough, the CF Foundation, and the volunteers and donors. Because of this community, Roland's life expectancy is so much more hopeful than I ever thought it would be. Thank you so much for allowing me to present.
Oh, Cambrey, thank you so much for sharing your story. That was beautiful. And we'll have time for questions at the end. You can also put questions in the chat if you have questions for our parents. And now I'd love to turn it over to Faith to share her story.
Yes. Hello, everyone, and thank you so much for being here today and having me on to sort of share my story. So yes, my name is Faith Shropshire, and I am the proud mother of a courageous, super hilarious, beautiful 8-year-old little boy living with cystic fibrosis. Today, I want to share with you a very personal story, our family's journey through the diagnosis, excuse me, the disbelief, the isolation, and ultimately into community, advocacy, and strength. Because for so long, our voices weren't heard. So when my son was born, I knew right off the bat something wasn't right. That instinct for me kicked in. You know, they say a mother always knows. And I definitely knew. He was struggling. He was struggling from the very beginning. He wasn't gaining weight properly. He wasn't feeding well. And his breathing seemed just a little bit off. My husband and I watched him in real time as our son basically began to deteriorate before our eyes. And yet, no one believed us. Excuse me. The doctors had dismissed our concerns when it came to V. We were told to give it time, that this would be something that he would eventually grow out of. We were told that the 5 pound, well, the 7 pounds that he was born at was normal. We were also told that when he lost 2 pounds and was around 5 pounds, that was also normal. This was all within maybe, I'm so sorry, maybe within a month of him being born, we started to experience this. So what made this even harder was that I had actually found out that I was a CF carrier when I was 20 weeks pregnant. So I kind of came in with a little bit of knowledge of knowing that. And when the symptoms started showing up in our son, that was actually the first thing that I brought up. So my son's pediatrician had offered to also refer us to AGI. She was looking into maybe getting him a feeding tube or some sort of supplementary formula to help him gain and maintain weight. But she just did not want to get him tested for cystic fibrosis at all. She just felt that because we were African-American people, my husband and I, and our son, that there was just no way that our son could be even a carrier of this disease. So it made everything so much harder for us. So she did refer us to the GI specialist, and we thought that we would get answers, but instead we were met with a lot of resistance. And that really began just this frustrating whirlwind of me just not feeling believed and dealing with a lot of the medical gaslighting and just kind of feeling like my concerns weren't valid. I was sitting here watching my son lose all of this weight and become to the point where it was a huge concern, but yet, like so many other stories, even as Cambrey mentioned, it was just like It didn't matter. So that we then asked her again directly, the pediatrician, could this be cystic fibrosis? And instead of the support, we just were dealing with the medical gaslighting, and our concerns were being brushed off. So this is just kind of on the slide here, just a couple of things that were said to us. We were told that newborns were just fussy. We are told that just by the look of him, that he looked healthy. He looks healthy to me. We're also told that we're probably overthinking because we are tired and very new parents. So for the first 7 weeks of my son's life, we actually lived in doctor's offices, begging and pleading for answers, asking for more tests and more answers. When he was finally given his first sweat test, we thought that that was it. We thought that we would have the clarity, but instead we were told that it was a false positive. So we waited 2 more agonizing weeks before we could finally hear the words, "Your son has cystic fibrosis." And it was almost like a relief when we actually heard them say it, because it's like, I knew this. I knew that something was off. And now we have answers, and now we can start treatment and start trying to get on the right track. So as devastating as that diagnosis was, it was also very validating for us. We finally had a name for the thing that we are fighting for. But even after the diagnosis, the isolation didn't end. A lot of the people that were closest to us, our own family, didn't believe us, or they didn't understand. They didn't know what CF was, so they couldn't see why we were canceling plans and missing family outings or being overprotective. We were trying to keep our son alive and keep him going. But to them, it sometimes looked like we were being difficult or distant or snooty. We were trying to, that also added to, I'm sure a lot of you probably know, it's a whole different type of heartache. The pain of not being supported in the way that you need when you need it the absolute most. So I got to a point where I said, enough is enough. I need people. I don't want to do this alone anymore. I'm not going to do this alone anymore. And I started finding healing in community. So it was a slow start, but I started to share my story. I started first just posting things on social media here and there. I would share, me giving V his enzymes or making his bottles. I would share the grief behind, like, cleaning up what was basically like an oil spill, if they pooped in a diaper. He heard that. He thought that was funny. And I eventually started sharing through other platforms. And the CF Foundation actually reached out to me, which was amazing. It was amazing because I felt like I wasn't invisible anymore. And it was so cool because the CF Foundation and Community Voice and just all of these other people who are living with CF or were affiliated with it, it was like I just opened up this vortex of, and I was just like being sucked into this wonderful, warm place where everybody understood what you're going through and what you're dealing with. And if they didn't, they were willing to ask questions and they're willing to help. So I found people who understood. And I learned that there were other people out there, especially other Black families as well, that were going through the same struggles. There were also families who didn't feel understood or seen by the medical system. There's families who fought for diagnosis, for care, for understanding. So I didn't just find community. I found strength. I found support. And then it became really liberating to share my journey. And I began to turn my pain into purpose. And eventually I joined Community Voice, and that changed everything for me. It gave me a platform to speak, a huge and very beautiful network of families and advocates. It gave me access to information that I wish that I had had in the beginning. And through Community Voice, I actually became more informed, more empowered, and more connected. And most importantly, I stopped feeling alone. My son has cystic fibrosis, and CF doesn't always look like you expect it to look. CF affects people of all different types of backgrounds, and yet families like mine are still being overlooked. Still delays in diagnoses, still fighting for credibility and representation. Representation matters because it absolutely saves lives. We need to be more diverse in our research, in our care teams, and in our community spaces. So I would urge everybody who is watching to listen to families, especially those who have been historically overlooked. Support organizations like the CF Foundation and Community Voice that are amplifying those diverse voices, and share stories like mine so that others don't feel alone. Advocate for each other and provide more equitable screening. And if you are a caregiver, speak up because your voice is powerful too. And to the other parents out there, if you're feeling alone, I absolutely see you. To the doctors, please, and care teams, please listen because it matters big time. And to anyone else wondering how you can help, start believing us when we are speaking and telling our stories. So today, my son is amazing. He's strong, he's thriving. He's been able to, he just celebrated his 8th birthday. This picture in the middle here's from today. He went swimming. Like, it's so exciting. He's got to do so many amazing things, and that's him over there in the corner doing therapy. So
That's me that had twist.
he had twist in that picture. He wanted to let y'all know that. So I'm very proud to be his mother, his advocate, and a part of this growing community. So thank you so much for letting us share our story. Thank you.
Great, thank you so much. That was beautiful. And V, thank you so much for letting your mom share your story with all of us.
You're welcome.
And you're so polite. Love it. And Marissa, would you like to continue with this conversation?
I would love to, and I love our surprise guest, Ivy. So you've heard a few themes maybe throughout this presentation, and one of them is that not everybody always has the capacity to participate or to get involved at any moment in time. And the health of their child comes first, always. But there's plenty of opportunities for individuals who are caregivers who have CF to get involved. And whether that is connecting with the local CF care center, connecting with your local chapter, as well as, you know, as Karey shared, she's become part of her state's board to help implement better practices for newborn screening for all types of diseases. So there's plenty of opportunities to involve patients and, as Faith said, to listen to them and to incorporate their experiences and their expertise, because nobody has gone through exactly what they have gone through. We have, like I mentioned, a few different programs like CF Peer Connect and Community Voice to help support, particularly in this topic of this webinar, parents of newly diagnosed children who maybe are seeking that sense of community and seeking to have somebody that just gets it, that gets what they've gone through, that gets what they're experiencing. So would encourage you to check out those programs, and you can reach out to us at the CF Foundation if you have any questions.
Excellent. Thank you so much. And now we'd love to open it up to all of you for questions. Anyone have questions for our parents or for Marissa that we can answer? You're welcome to put them in the chat or take yourself off mute if you have questions or comments.
Hi, it's Lena from Boston Children's. I just have a quick comment to all the brave parents for sharing your stories, and appreciate the diversity of the panel of stories that you told. There's so much to learn from this and so much to advocate for. The expansion of the panel. I wrote to Cambrey directly that I was sad to hear that she received the diagnosis by phone. I'm hoping CF centers can improve that process so that it's in person. So there's some hand holding and supportive measures taken. And definitely to Faith, I really hope that we can continue to provide education to those in the community so that there are not communities that are disregarded for exploring this. I mean, a sweat test is so benign to be one of the avenues for diagnosis. So hoping that we can continue. Thank you. You're motivating for sure. So thank you so much.
Thank you.
Thank you, Lena. That was perfectly said. Jennifer?
Thank you so much to everyone for these really horrific stories and for sharing with us. I'm from UNC in North Carolina, and we last year were a recipient of one of the SIP awards, and have had the luxury of having two parent partners join onto our SIP team, and it is really amazing the difference that the turn that we have taken in our overall SIP program compared to what we originally proposed in the grant, and how that's just changed by having their input. And so this is kind of a comment and kind of a question, but our parents had raised the issue that with the Sunshine Act in 2021, and maybe you guys were not subject to that because I think your children were born before that for the most part. But now all lab test results get released to families before the physicians or the team has had a chance to review them. And so, if I'm in clinic all day, I'm not seeing the litany of stuff that's coming through. And so it's very likely that a parent is going to see a newborn screening result before anyone has a chance to even reach out to them on the phone, never mind get them into clinic. And that has happened to both of the parents, and we are currently trying to recruit additional input from other families within North Carolina so that we can maybe address this at our state level, given the two-tiered screening that we do. We do the IRT DNA, and so I'm curious if there's any other panels, any other patient representatives on the panel, or if any of our of the speakers had experienced anything with that, and sort of getting that reveal coming from just an alert on your kid's MyChart app that you have an abnormal newborn screening. Because it is not seemingly as easy to fix as I thought it was going to be. And it's something that we're really kind of trying to focus as part of our SIP award now.
Jennifer, I would comment that I know this is a problem in other states, and our team here is working with some states on how to change the wording that goes into those reports. And I think that's probably what you're talking about too, so that it's not it's maybe less definitive, maybe a little bit less scary. So when a family sees it, they are seeing something that's here's who to contact. They have that information there, but it's not as scary as I think some of the results can be initially when you first read them. But it is a problem that you can see those results in MyChart before the pediatrician or the pulmonologist calls. Does anybody else have any other experience or solutions with that? Because I think that is a big challenge.
maybe a little bit different than that, but I am Ambika Shenoy from CHOP. And first of all, I wanted to say thank you so much to the presenters. Your stories are so impactful, and it's really inspiring to all of us who do work in this area to try to find solutions and try to improve the system in which we practice. I will say we've had a change in the Pennsylvania newborn screening algorithm, and some of the differences that we noticed was the change in how screening is done by adding a tier of expanded CFTR gene sequencing has changed some of the outcomes and referrals, but a lot of times that, sometimes the primary care provider may not be as up to date with that. And so a lot of times families who have two variants that are identified now come in and are told your child is most likely a carrier. You just need to get a sweat test. And so I think along the lines of what Jennifer is sort of getting at as well, there's a lot of changes on different levels and ways that we need to partner and provide education to those who are on the front lines, from a CF center level, from a state newborn screening level, and also, to get the input of families on that, because, I think it's really helpful to get information from somebody that you know and trust and have a relationship with to begin with, rather than finding out. So sometimes it's just jarring to find something out from somebody new in a new setting and a new practice, and it's not something that you were expecting to hear.
Yeah, absolutely. And you bring up the really good point of that educational piece, that there's so many places that we need to continue to educate primary care providers in what newborn screening is, and that newborn CF can happen in the entire population. It's not just children who are of a white background, that all children can experience CF. But in addition to that, what the screening means, and once we have changes in screening, it's critical to educate them. So very important across the board. And you're now in a state, I believe, Ambika, in Pennsylvania, that you are just calling out those who have two variants. So you're not calling out one variant as needing a sweat test. So that's a big change too from what you were previously doing, right? So that
is different. And actually, I saw Marissa had put in the chat about SIP award. So we have a SIP award at our center as well, and so a lot of education is going into reaching out to PCPs within our system to begin with, and then to extrapolate that further. But to say, a newborn screen is a screen. A negative, quote unquote, newborn screen does not rule out cystic fibrosis. You still have to have some clinical suspicion in these cases. And to Cambrey's point that she had brought up, if there are those things that are happening, you really should absolutely get a sweat test.
Yeah. I think both Cambrey and Faith, who were advocates for their children, had they not advocated as much as they did, their diagnoses would have been even further delayed, right? And so there's a lot of parents who don't have the ability or the education to do that advocacy, and they don't know that that CF is a possibility. So kudos to Faith and Cambrey, and we also need to take that off of the parents, and that needs to be, the pediatricians who are helping us with that.
Yeah, and just to kind of piggyback or reiterate what you both are saying, I remember after we got the diagnosis, I did call the pediatrician and I said, hey, his sweat chloride test was positive for CF. And she was like, no, I looked at the newborn screening. It was negative. How is this possible? And so I think I love our pediatrician. She's amazing. I think it's just reiterating the fact that pediatricians have a lot going on, and there does need to be more education that, like you said, it is just a screening. It's not the gold standard like a sweat test is. So yeah, just reiterating what you all are saying. So
Excellent. Any other questions or comments before we end today? All right. I'm putting up my contact information and Marissa's. If you would like to be in contact with any of the parents, please reach out to us and we can forward that information on to them as well. We are so happy that you all were able to join us today, and just incredibly grateful for our three parents who shared their stories and have been willing to be advocates for the cause, as well as really helping us to form the guidelines. I can't tell you how, as Megan said earlier, how influential your opinions and thoughts and lived experiences were in forming national guidelines that are going to guide the course of cystic fibrosis newborn screening moving forward. So thank you so much for sharing that with us and for sharing your experience today. All right, thank you so much. We look forward to seeing you on our next webinar.